It felt good not only to save his life, but to be a part of that team. I mean, everybody from registration to the secretary to every person played a huge part in saving him. If one of those links was broken anywhere, the outcome probably wouldn't have been the same. My name's Sue Madar. I am the clinical coordinator, unit educator of the pediatric emergency room.
My name is Melissa Thomas. I am one of the pediatric critical care attendings at Goriab Children's Hospital.
Ms. Sonia Hartman, I'm unit representative for emergency department at Morristown Medical Center.
My name is Laura Danielson, and I'm a registered nurse in the pediatric emergency
My
department.
name is Joy Whipple, and I'm a registrar on patient access,
My name is
ED.
Niraj Kairam. I'm a pediatric emergency medicine physician here at Morristown Medical Center.
What happened that day was we had a couple patients that were coming in through triage, so I brought the other patients in first. I did not see this patient out in the waiting room. And as I went out in the hallway to get something for one of the other patients, the secretary, Sonia, said, "Sue, there's somebody out there that Joy's really concerned about. Can you go out?"
It was a little busy that day in the emergency room. The patient access registrar is Joy. She walked in and she said, there's a kid out in the waiting room, doesn't look very good to me. It was the way she said it, she was like nervous for him.
The patient mom came up to the window to get registered. So she registered the patient. She told me herself that her son was very lethargic. So I looked over and I saw the son laying on the dad's lap. And I knew right then and then the patient didn't look well. So I got up, went to the secretary, told the secretary, Sonia, that the patient outside looks very lethargic and someone needs to come out right away.
So I dropped what I was doing, went out to the waiting room, and sure enough, there was a limp little boy out in the waiting room. I brought him in, started to ask his history, and realized no matter what they say, it doesn't really matter, I need help in here. So I went and got Dr. Kairam.
What I saw was a very ill-appearing boy, looked almost lifeless, and quickly recognized that we needed to do some immediate resuscitation on him.
So she came in, and with that, Laura and the tech Rima also came in.
Sue, who was the primary nurse, was in the room, and I just jumped in to help her. And really, that's when it all started.
He was pretty sick, just lying there limp. Sticking him with an IV did not faze him at all, which is never a good sign for a kid. We knew we had to get fluids in him. We were pushing the fluids. At some point, we had to move him from the little room that he was in to our big resuscitation room, where we just continued to work on him for a couple of hours. Surgery came down because at some point they realized it was probably something with his gut, and surgical resident came first, then the surgical attending came, and the PICU attending came down.
I was called to the emergency room to evaluate a young boy who seems to present with a complication of an abdominal process. I found the young boy to be significantly distressed with a significant abdominal pathology, and we immediately started with the resuscitation that he required.
He was too unstable to go to the OR, so we had to keep him there and just keep working on him and working on him until he became stable enough to go to the OR, which is what he really needed to save his life. What made that day and that event different, I went over in my head that day because I was like, this was just totally different. Like, everybody's ego was checked out the door. Nobody had an ego. It wasn't about them. It was about the patient. At one point, and I probably will remember this to the day I die, at one point I was trying to push fluids on him, and they wanted me to push more fluids and get something else, and I'm like, I can't. I just have my two hands here. And the surgical attending said, what can I do to help you? And he really meant it. He was like, what can I do? And I'm like, you could get me a bag of fluids. He's like, where? I'm like, there's some in the warmer across the hallway. He went and got the fluids. He spiked the bag for me, told him how to do it as I was doing stuff. And it just was like, wow, this is just, it's just different. It just, the whole thing was different.
I think this highlights the role that everyone in the hospital setting can have and can impact patients and their care. You don't have to be the doctor, you don't have to be the nurse. Every single person can make an impact and make a difference.
I think that we work in an amazing place, and we have great people to work with, and we trust each other.
To be a trusted network of caring, it does mean that people have to put their faith in you. These parents, I could use this as a perfect example, these parents never met me before. They saw my actions, they saw the other nurses' actions, they saw the doctor's actions, and they basically gave their son's life to us. Here, you need to save him, you need to help. That's a trusted network of caring. That people are putting trust in you, your abilities, your teamwork, everything. And that's what being a part of Atlantic Health is.